The COVID-19 pandemic brought a surge in the use of telehealth physiotherapy, commonly referred to as telephysio, in treating musculoskeletal conditions. While its widespread adoption has likely declined in many countries as life has returned to normal, the pandemic catalyzed significant growth in its usage. For instance, in Switzerland, telephysio adoption skyrocketed from just 5% to an impressive 45% during the peak of social distancing and lockdown measures. Although current usage may not match these heights, the public is now more receptive to telephysio than ever before. But what exactly are its advantages and disadvantages? Is telephysio feasible for all types of physio problems? And what does the process of utilizing it usually look like? Well, we answer all these questions today. But first, as always, please take note of our disclaimer. The shift in people being more open to telephysio can be attributed to several key factors. First, patients and providers became more familiar and comfortable with technology, driven by the necessity of performing online activities that were traditionally done in person, such as working or seeking healthcare services. Second, telephysio eliminates the need to spend substantial time preparing, commuting, and searching for parking when attending in-person sessions, as these usually require it. This is especially beneficial for people juggling work and family responsibilities, as it helps them stay consistent with their treatment programs over time. Third, the accessibility of telephysio, heightened during the COVID-19 pandemic, have made it an appealing option. For individuals with mobility challenges or those living in remote areas, receiving treatment from home offers significant advantages. Finally, research has validated the effectiveness of virtual physiotherapy, demonstrating its value and encouraging its integration into healthcare practices. For instance, one systematic review suggests that high patient satisfaction and adherence levels are values equivalent to traditional physio. Of course, despite these advantages of telephysio, there's no doubt that it also has its disadvantages, especially in areas such as manual therapy, specialized equipment, and above all, diagnostic accuracy. The ability to perform hands-on assessments and treatments or use advanced therapeutic equipment reduces the comprehensiveness and precision of diagnosis and treatment for certain conditions. This is particularly true for individuals presenting with one or more traumatic injuries following events like a fall or car accident. These injuries present added complexity for physiotherapy due to the critical need to manage factors such as pain, weight-bearing restrictions, movement limitations, safety concerns, tissue healing, and the potential for complications like infections. Therefore, we believe that traumatic injuries require in-person sessions to more reliably assess the severity of the injury, better identify the affected structures through manual testing, and carry out a safe and effective treatment plan. Given these factors, telephysio is not practical and could potentially be harmful in these cases. However, this is much less of an issue for gradual onset musculoskeletal problems, such as nerve impingement, tendinopathies, or muscle strains. Granted, it's likewise harder to properly diagnose conditions like these too when an assessment is carried out online. However, because gradual onset musculoskeletal problems are often linked to predictable causes like subpar postural patterns resulting from weight gain, poor ergonomics, and/or sedentary behavior, which causes deficits in mobility, muscle balance, and stability, a detailed in-person assessment is less critical. Treatment can target these deficits and address postural imbalances through tailored exercise-based interventions, which are well suited for management via virtual consultations. Therefore, telephysio is still feasible for the effective treatment of these problems for many. So how exactly does telephysio look like practically? But just on a quick side note, if you'd like to undertake our evidence-based and results-backed personalized plate-weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Before the first consultation, your digital physiotherapist will send you a consent form and a digital subjective evaluation form. The consent form covers remote care agreement, privacy, data security, and the limitations of virtual assessments. The evaluation form gathers key information like personal details, medical history, symptoms, so like pain, stiffness, weakness, their causes, affected areas, aggravating factors, physiotherapy goals, and red flags. This information allows physiotherapists to prepare follow-up questions and focus on visual assessment, rapport building, and education during the session. Patients are typically reminded via email on the appointment day, outlining expectations such as being on time, in a private space, and ensuring a stable internet connection. Best practices include clear audio and video, comfortable clothing, and having exercise equipment like a resistance band on hand. It's also recommended to have a phone ready in case of technical difficulties. After an initial rapport building conversation, the physiotherapist will ask follow-up questions to clarify or confirm the information previously provided. Next, a physical assessment begins. While again a hands-on evaluation isn't possible remotely, a visual assessment offers valuable insights into movement, posture, and signs of inflammation or injury. The therapist may ask you to position yourself far enough away from the camera to view your entire body, allowing them to assess posture, movement patterns, gait, and how different body parts function during exercises or tasks. Ensure the consultation space is large enough to allow for this. Based on the assessment, a probable diagnosis is made, followed by a treatment plan. Follow-up sessions are scheduled to track progress, adjust exercises, and provide ongoing feedback and support. After the call, or at the end of it, if time allows, the physiotherapist will provide you with a code for a telephysio app. Through the app, you'll access pre-selected personalized exercises tailored to your specific issue, complete with video demonstrations, written instructions, and guidance. These apps also offer additional features like tracking outcome measures, daily pain ratings, and setting exercise reminders. Again, if time permits, the physiotherapist may also screen share the exercises they've assigned, guiding you on how to perform them correctly further. One limitation of telephysio is the reduced access to specialized exercise equipment. However, everyday household items can easily substitute in most cases. For example, a belt, towel, or sheet can be used for stretches, cushions for stability, and water bottles for added resistance in some exercises. While water bottles may not work well for all strength exercises, investing in a reasonable priced resistance band is a convenient and effective alternative. Typically, medium resistance is sufficient. Have you had telephysio before? What were your experiences? We'd love to hear from you in the comments section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So that has been our video. Thanks for watching, and I'll see you next time.